See, when we started this institute in 1996, we did not start this institute to run this Bachelor of Audiology Speech Language Pathology program. We started this institute to create a center of excellence, which means this center should be able to provide or treat or restore problems which can never be treated before. Restoring the lost function. It is not repairing it, restoring it, right? Now, when 1996, when we started, one of the biggest problem was, you see a lot of children, deaf children, born with deafness, they wear a hearing aid and they go to deaf school. The biggest question what we had was, despite wearing the hearing aid, why they have to go to deaf school? When they wear a machine for hearing, they should go to, they should have normal hearing, they should go to normal school.
Correct.
So either they go to deaf school without the machine, or with the machine, if they go to deaf school, that means what? Even with the machine, they're still deaf. That's what it means.
Right, right.
So the point is, there is a certain degree of deafness, even the hearing aid cannot treat. Hearing aid cannot help or aid. Okay, so those sort of people have to remain deaf throughout their life. Now, how do we solve this problem? So in 1997, we did a very radical procedure called cochlear implants. That was the first time it was done to prove to the this part of the country that even somebody who is born deaf can be made here normal like anyone of us. This we did it for the first time in 1997 to show this country as it works. And this was done for 2 people. At that time, it was costing 5-6 lakhs. We took loan from our own side. Of course, I must mention a very important person here is Professor Dr. Mohan Kameshwaran. He is the founder of MERF.
Okay.
So when he started, he personally, I was with him since 1996 when we started. Okay, so in fact, I was 18, 19 years old when 20 years old when we started the first cochlear implant program in the country, right? And that too, though I'm young, I was the youngest audiologist in the whole of country who has got the experience in cochlear implant. Rather, I'm the only audiologist in the country who has done a cochlear implant at that time.
Okay.
Now, this cochlear implant was performed, we shown the world as it works, and a lot of children slowly came up for cochlear implant. We did restored hearing for all these kids. They had normal hearing, they spoke normal, they went to normal school like anyone of us. So that's proven. We had a bigger challenge. The bigger challenge was, there were a lot of children who are born deaf, in whom even a cochlear implant cannot be done.
Okay.
Which means, when you have a cochlea, I think most of the students here are biology. So in biology, you must have studied cochlea as the inner ear. The inner ear has got a special cell called the hair cell. The function of the hair cell is to convert the sound into electrical signal. When the cells are dead, they become completely deaf. So in those cases, inside the cochlea, you put an electrode, which is called a cochlear implant, to restore hearing for them. But if there is a child who is born without the cochlea, no inner ear, no nerve, what will you do? You can't even put a cochlear implant. So what do we do for these people? So we told that, we are going to restore hearing, right? Now, how will you restore hearing for them? So then we introduced a technology called the brainstem implant. So our institute was the first institute in the whole of Asia to do it. For the brainstem, we bypass the cochlea, we put the chip in the brain and we make them hear. It's called the auditory brainstem implant. Now, I want everybody's attention here. This auditory brainstem implant is a very, very sophisticated procedure, very sophisticated medical procedure. Compared to any medical procedure, this is one of the most sophisticated thing in our opinion. So what are the other sophisticated procedures? You might have seen heart transplant, you might have seen lung transplant, which is very good. I really appreciate the kind of work the professionals doing in that area, transplanting the whole heart, whole lungs. Nothing undermining them, right? But these are done for people, those are 55, 60, 65, 70, 70 plus. And the life expectation after the heart transplant or a lung transplant or a liver transplant, whatever, maybe for 10 years or 15 years or whatever it is. I don't have the data, but on an average 15 years, let's say, maximum. So The brainstem implant is done on a 1.5-year-old child. The expectation is for next 70 years, life expectation. So you have to, then you are the person who is responsible for this child for next 70 years, right? So this is very, very sophisticated procedure. Okay, why is it sophisticated? Okay, because the place in which you put this electrode is highly complicated. You want to place the electrode in the brainstem. Okay, in the brainstem, you will have to place it. Now, let me tell what the complication in this. Before going into the complication, I'll tell you what is the role of the audiologist in this first. That's what you need to understand first, rather than the complication. Now, who is the person who will diagnose whether this patient needs a brainstem implant or not? Is audiologist. Because most often there is a lot of indications that come from radiology that the nerve is absent. But in many cases, as an audiologist, I've challenged and proven that the nerve is present and nerve is functioning. When the nerve is present and the nerve is functioning, then you don't need a brainstem implant. When the nerve is absent, you need a brainstem implant. See, just by making the small, intricate differential diagnosis, you change the whole treatment itself. Okay, and the cost of the treatment is different. If you want to go for a brainstem implant, it is going to cost you around 25 lakhs for 1 year for one child. If you're going to go for a cochlear implant, it is going to cost only 5 lakhs or 6 lakhs. Just by this small differential diagnosis, that what an audiologist make, the whole diagnosis, the whole treatment changes. This is how your importance comes into play. And only you can make that change. Only you can do the diagnosis. Right. Okay. So you decide whether this child needs a brainstem implant or a cochlear implant. You are an important decision maker apart from your team members or along with your team members. Now, once the decision is made, the child is posted for brainstem surgery. The surgeon will open the brainstem. And then the problem is this chip called the brainstem implant chip has to be placed, or what we call as an electrode array. It has to be placed on a specific area in the brainstem, which is called cochlear nucleus. The size of the cochlear nucleus is 3 millimeters. And it is underneath. You cannot see. It is behind. You can't remove the peduncle to see the or the brainstem to see the to that. So it is like surgeon has to blindly put it inside based on anatomical landmarks and the skill he will do it. Then the audiologist will take over that surgical procedure, and he is the person who is going to do some measurements, procedures, and tell the surgeon whether it is in the cochlear nucleus or somewhere else. So if this electrode is on the cochlear nucleus, the child will hear. If this electrode is not on the cochlear nucleus, which is 3 millimeters, the child will have other complications. The child may even have a respiratory problem. Child may even die. So the important decision maker in the surgery there is an audiologist who is going to give a very important information for the surgeon to position it properly. Right. So that's the level of audiological work that is happening today. That is why I wanted to highlight what's the level of audiological work which is happening in the world. But not just testing hearing and giving machine. Your job is to that level of work. Right. Now, once you say, okay, this is the right position, and your role alone within the theater, your job alone, it's for 1 hour to 1.5 hours. You will be doing the procedure in the surgery. Right. After the surgery is done, everything is okay. Again, once the wound is healed, the child will come back to you. You are the person who is going to program the chip which is kept inside the electrode to program it in such a way there is a communication between the nerve cell in the brain and this, and they communicate, and you make the person code signals for the brain to hear and understand signals and speech. It's a very, very high profile work. Once you code and make the child hear, the child is going to hear. Then you have to train the child to listen, train the child to speak, learn language and speak the language. So to convert a child who is born without the ear to a normal person who can hear and speak, 90% of your work is audiologist work in the whole team. Right from A to Z. So this is the level of work audiologists are doing today. Okay. So we did the first brainstem implant in 2004, where nobody knows what brainstem implant is at that time. Right. But after doing the brainstem implant, we realized something very, very important. What is it? That, as I told you, 90% of the role in the whole brainstem implant program is the audiologist and speech pathologist role. Of course, the surgeon play a major role in it. There is no doubt about it. But that their role is during the surgery. But that's a very important role. But prior to surgery, during surgery, and after surgery, you're going to see the child every day. You're going to treat them. You're going to go to them, right? So they do the 90% of the work. But audiologists don't have great experience in this area of work, because this is a very high level work which is done in only very specialized excellent center of excellences all over the world. And MERF is the second biggest hearing restoration center in the world for this brainstem. So we decided, since we have all the facilities, infrastructure in the area of hearing, speech, and language, whatever is latest, let us run a program by ourselves so that we can create next generation of professionals when they go.
Okay.
And that is the reason why we started this course.
Okay.
So the institution was not started for the course. Institution was there and the course was started because we had everything, so that we can train better professionals and create good professionals to the society. Right. And that is why we started this course. Right. And that is why we only have audiology and speech language pathology. We are not diversified into physio, other paramedical or dental or medicine. Our focus is only in this. In audiology, speech language pathology, you have undergraduation. We have undergraduation, we have post-graduation, we have PhD, we have specialization. Everything in this field we have, but only in this field. Right. So the reason why I have to make this I have to tell this is to make you understand the importance of this audiology, right? And then what happens is the speech therapy. Then we have a lot of patients with cancer, where you remove the entire larynx, you put an artificial larynx. For some patients, you can't put an artificial larynx. You have to teach them different techniques to speak. We have patients, those who speak even without larynx. It's possible because of speech pathologists. Otherwise, they don't speak. They go psychologically, they become depressed and die faster. You make them speak, you make them communicate again. Right. We have children with cerebral palsy, children with mental retardation, children with Down syndrome, children with autism. Right. Now, the most important thing is, apart from all those things, I want to highlight you. Our aim is to create best professionals. We don't want professionals 1 among 100. We want 1 out of 100. So the most important thing, qualification to take up this course,